Welcome to the Spine and Orthopedic Institute at St. Vincent Charity Medical Center. As your surgery date approaches, you undoubtedly have a lot of things on your mind. In this video, we'll help you get a sense of what to expect on the day of surgery and in the first few days following your procedure. We'll meet your St. Vincent Charity doctors and caregivers. We'll walk through the check-in procedures, and we'll take a tour of the facilities so you'll know exactly what to expect. So, let's get started. In the days before your procedure, we'll contact you with a specific surgery date and check-in time. You'll also receive information on what to bring with you, including clothing, personal items, toiletries, and required paperwork. Please plan on leaving any valuables at home. We'll also provide you with important details about preparing for surgery, including what to eat and drink, medications, and more. When you arrive, please use the valet parking accessible off of Community College Boulevard and enter through the main hospital doors. The admitting office is located in the lobby, where a greeter will escort you and your family up to the third floor. Family and friends are invited to wait for you in the family waiting area. You should leave any personal belongings, such as purses, wallets, and cell phones here. Next, you'll check in at the registration desk, where a nurse will escort you to a private room and take your pulse, blood pressure, and temperature. You'll also be given a hospital gown to wear. Once you're ready, you will be escorted to a waiting area. Here, you'll meet your anesthesiologist, who will make sure you are comfortable throughout the procedure. You'll also receive a mild sedative to help you relax. Finally, your master surgeon will greet you and answer any questions before you are taken into the operating room. Next thing you'll know, the operation will be over and you'll wake up in the recovery room. During your stay at St. Vincent Charity, you'll have your own private room with a team of nurses focused on your care and comfort. When you arrive from recovery, your nurse will take your vital signs, ask you some questions, and administer a few simple tests, such as moving your arms and legs. Depending on your procedure, you may have a brace to restrict motion, and your nurse or therapist will talk with you about what movement is okay. Your doctor will want you up and out of bed as quickly as possible. You heal faster when you are using your muscles because your circulation improves, which sends more blood to the surgery site. We understand that you will be stiff and sore, and we know that you may be reluctant to move for fear of hurting the surgery site. Your therapist will be right by your side to reassure you through this process. In fact, during these first few days of recovery, you and your team will work together to get you stronger with each passing day. They will help manage your pain with medications, and they will teach you important exercises that will help your body recover faster, as well as reduce the risk of blood clots and other complications. As you recover, your doctor will check on you and answer questions. In addition, specialized nurses and staff will visit to make sure all your needs are being met. Within a few days, you should be moving better, and your doctor will determine if you're ready to go home. Naturally, this can be a very exciting moment, but it's also normal to feel a little anxious. As always, we are right there to help. Your doctor will go over all the details with you, including medications, activity levels, and when you should come back for follow-up. If you think you need help with daily activities, your team will help you make a plan to ensure everything is covered once you're home. Before you leave, we'll give you specific instructions in writing for your recovery, along with the phone numbers to call if you have any questions or concerns. You'll also receive a prescription for your medications, or we may call them in to your pharmacy for you. With your surgery behind you, you're on to the next phase of the journey: rehab and recovery. The third video in our series provides a preview of what to expect as you begin working your way back to a life filled with renewed energy and activity.